Hi, we're live. And I'm just going to make sure that I'm audible. So bear with me a second, guys. Where are we? And guys. Yes, good. Okay, fantastic. Yeah. Welcome, everybody. Hello, and thank you so much for joining me again today. It's really good to see you. This is a bit unusual time to be having one of our live streams, but this is what we can get at the moment. So if you're watching on the replay, I'm sorry that you couldn't catch me live because I know we usually do these things on a Sunday evening, but let's see how this session goes. Now, it's been a good couple of minutes since the live stream, so I've had a pile of questions that I've been sitting on waiting to answer. We're going to tackle all of them in this stream. My name is Dr. Sylvia. I'm a general practitioner based in the United Kingdom, and this is Ask Away Health. We talk about everything related to women's health, sexual and reproductive health care, and I think that the topics we have today will be of very much interest to most, if not every woman or every person listening to this video. So we've got 4 questions. I'm going to go into them in a little bit. Covering fibroids and Bartholin cysts, as you probably have guessed from the thumbnail. And if you have any questions related to these topics, then of course I'm happy to look at them in the if you want to drop them in the comment section. Before we go too far into the stream, let me just put up a disclaimer, because yes, indeed, we are happy to talk about these different health conditions. I'm happy to share thoughts around these different health conditions, but just to remind you that I'm not your registered medical practitioner. I can't give you specific medical advice. I can, of course, signpost you, give you information, but I strongly, strongly encourage always that you contact your own specialist, your own family doctor, because they know your medical background and can provide you a greater, I believe, greater care and service by tailoring the information or the guidance specific to your own health needs. So please bear that in mind, that everything that we're saying here is providing health information to guide everyone. Okay, so today's episode, or today's episode, well, I don't know, program is being sponsored by yourgpconsultation.com. So this is for UK-based residents or UK-based individuals. Yourgpconsultation.com is a partner for providing private online video consultations, really around anything related to family practice or family health, but specially tailored to women and sexual health. So I hope that if you're UK-based and you wanted to have a conversation with a doctor about a health-related issue, you use the opportunity to book onto our service. I will leave the links in the description box below. I was going to put up a QR code that I could share during the stream. It completely went out of my head. But anyway, we are here. So let's get started. The very first question, and I was a little bit taken aback. It was a little bit surprising when I first came across that comment, because yes, I don't expect everybody to agree with me or agree with the points I make on my channel, and that's fine. As long as you do that in a respectable manner and you put your arguments forward, we can have a conversation. And so I've brought this particular comment up because they weren't rude. They just made their own comments. They just provided their point of view, and off they went. Fair enough. But I wanted to address it. I want to bring it up, and I would love to hear from you what you guys think, especially if you're watching this now or watching the replay. Because this is not just related to somebody who has fibroids. It concerns, a category of food that we eat. So let me share that. Let's just get cracking. Let me share that. Now, while I'm getting the things together, please don't forget to give this video a like. It is very much appreciated. It is completely free of charge to just click the like button. It is absolutely free to subscribe to the channel if you love what we're doing and support the work that we're doing, trying to share health information to empower everybody. So let me pull up that first comment and just make sure that you can see my screen. Something very weird is happening to my computer at this moment in time. Guys, just bear with me. Yeah. Something interesting is going on my computer. I don't know what's happening. All of a sudden, I'm getting a shivering screen. I can't see my setup. Give it a moment, guys. Don't go away. Let's see if we can get things back. it may be that I've got too many windows open on my desktop. So let me close the ones that I don't really need, because I do sometimes have quite a lot going on. Okay, so let's try that again. I don't know, I apologize for that glitch. Let me try that again. It just said it couldn't play. I'm sure it played it earlier because I tested this earlier. Here we go. It seems to be working okay. If you're watching me live, please let me know. Where's my phone? I'll just double check that people can actually see it. Otherwise, I might have to turn this down. Let's see. Yeah, let's see. Okay, I think we're good. I think we're good. I think that this is visible. I'll just keep my phone close by so that oh, okay, spare glasses. I'll just keep my phone close by so that if something glitches again, I know what's going on. Right, so this is what we're dealing with. So usually, guys, I don't, hang on, let me see, let me look at you. Usually I don't put people's names when I'm discussing questions or comments, because I think even though you share your I think even though you share your details on the page, when you drop your comment, I think that when I'm discussing it and probably going into intimate information, it's fair just to keep information hidden or just to block off an individual's name. But I've intentionally put this up here because I really want to encourage somebody who has the boldness to challenge another individual in a fairly respectable manner. It may not feel nice to the person receiving the feedback at that point, but if you're not throwing insults or accusing them of lying or whatever, then you can have a conversation. And that's why I've put up this individual's name, because I encourage advocacy. And advocacy might sometimes mean that you're saying to your doctor that you don't agree with them and trying to put forward reasons why you don't agree with them, so that they can either refer you on to a specialist to arrange for you to have more tests. Women, we not just women, sometimes we have to do that a lot. When you think about when there are delays in diagnosis, I don't know what's happening to the stream. It's going on again. Wow. Okay. This is really interesting. It's not happened before. Yeah, it's not happened. I'm a bit stuck for words because I haven't. Okay. So let me leave the studio. Yeah, I'm still very much here, but something's going on with the system. Let's see what we can do about this. I've closed as many of the windows on here that we don't really need, so I don't have too many windows open at this time. All right, so why I don't know if that's any better. I think there's some kind of delay. It seems to me there's some kind of delay. I don't know. This is the time when you wish you would. Okay, I think we're good. I think we're good. No, this is something. This is the time when you wish you would. Okay. I think I'm back. No, something. I think I'm back. Okay. Okay, I think I'm back. Listen, if you're here live, I apologize. I'm not sure what's going on. And if you're watching on the replay, we're going to cut all these bits off. I don't want to end the stream because I'm not sure whether I can just start it. I probably can, but it seems to be working okay now. So let's just carry on. I was still just giving a preamble. I hadn't really gone into detail, but I was just explaining why I'd chosen this particular topic. And I wanted to share it with us. And it's not that one, beg your pardon. It's this one. This is the first one. So this is a comment that somebody left on one of my videos where I was talking about a guide to fibroids shrinking with vitamins, because it's a very popular topic. It's a conversation that people want to have around non-hormone treatments, non-surgical treatments for dealing with fibroids and their symptoms. So it's a video I shared looking at five different vitamins and just really trying to analyze whether they will provide you some value in terms of dealing with fibroids. That was the essential goal of the video. And then I got this comment on the bottom of the video from somebody who presumably had tried to watch, and they were expressing their dissatisfaction. Now, I wanted to bring this forward because of the way they've expressed their dissatisfaction. They weren't rude about it, and the comments sounded slightly abrasive to me. Clearly, they were not happy, and they could have left without dropping the comment. But I think the fact that they dropped the comment provides some value both to me and for us as a community, so that we can have a conversation around this. So I've left their details on this comment, whereas usually I would remove the details, I would block it off. So at Wandering Inca, who left this comment, I think it was a couple of weeks ago, but I've not been live, so I've just sort of sat on this. But I promised myself that the very next live that I have, I must have a conversation. You left this comment on my video. You said, I stopped the video as soon as you said you recommend fortified cereals. With all the information we have about the detriment of processed grains and cereals now, I can't take anything you say seriously after that. So this is the comment that at Wandering Inca left on my video after they watched presumably a couple of minutes or less of this. I think this is about a 5 or 6 minute video. It's not a very long one. They didn't watch everything. And like I've explained why I've brought it up, because I could have decided not to share this. I could have decided to delete the comment. I haven't deleted the comment and I don't intend to, but I do want to share my thoughts and I do want to provide some education because I think there's room for that. First of all, like I said, I appreciate the fact that they drop the comment without saying, oh, you're telling lies, you're doing this, as many people will just sort of drop a comment and just be disrespectful. Obviously, the comment is abrasive, is not pleasant to listen to or to receive, but they have their absolute right to not want to watch the video, just to walk away. That's fine. I don't expect that everybody will love what I say. So not a problem. Now, the next thing I want to do before I make my comment is I want to share a little bit of that video because I want you to hear, especially if you haven't watched it or you don't intend to watch it, I want you to see the comment I made. It's not a very long video, so you can go ahead and watch it. I might link it in the comments, in the description. I'm sorry, when I finish with this live stream, I might leave a link for this, and you're welcome to have a look at the entire video, and then you can judge for yourself. But this is what I said that I think at Wandering Inca was not happy with. I'm going to turn up the volume to make sure that you can hear me. Just bear with me a second, guys. And please don't forget to give this video a like if you're watching here, if you're watching on the replay, please. Thank you. Now, while vitamins won't shrink fibroids on their own, they may support your body's overall health and help you manage symptoms. Let's begin with vitamin D. Vitamin D is an essential fat-soluble vitamin. It helps to regulate the amount of calcium and phosphate in the body and is activated by ultraviolet light. Natural sources include sunlight, fortified cereals, fatty fish like salmon and mackerel, egg yolks, fortified dairy products, liver, and dietary supplements. Now, while vitamin... Okay, so that is the video in question. This is the video that at Wandering Inca felt very unhappy with and felt disturbed by, and said, as soon as I mentioned I recommend fortified cereals she couldn't listen any further. In fact, she said she couldn't take anything I say seriously afterwards. You guys saw it, that's what she said. Well, thanks for your feedback and your priority for non-fortified foods. And again, I respect that. That's up to yourself. Of course, like many other, if not all practitioners, of course, I share concerns about highly processed foods and their concerns. I think the first thing I'm going to say is that I did not recommend fortified foods as a blanket guide for managing fibroids. That particular clip and any other where I mentioned fortified milk or fortified dairy foods in that clip or at any point in the video, I'm looking at the potential benefits that one can get from any fortified foods or fortified material, or any fortified, any kind of diet or, food sources that have been processed and fortified. But what do we mean by fortified foods? So number one, you can't put a blanket ban on fortified foods. So at Wondering Inca, I'm going to, after this stream, I'm going to respond to your comments and I'm going to leave the link to this video, which is why I haven't responded yet. I'm going to leave the link to this video. You can't put a blanket ban on fortified foods. And let me explain why. The purpose of fortification is because you want to add essential nutrients or micronutrients to food, so that when we eat those foods, we can get the sufficient amount of those micronutrients that our bodies require. Because it may be that if we eat those foods without the added micronutrients, we may not get enough. It's important to say that just because a food is fortified doesn't mean that it's healthy. That is true. And I didn't think to make that point in the video because that wasn't exactly the purpose of that video. The purpose of the video, like I said, and which was made clear in the as I began the video, was to look at which vitamins could influence fibroids. And of course, it makes sense to talk about where vitamins can be sourced. And I mentioned a variety of different sources of vitamins. The other thing I would like to say as well is that fortified foods, of course, they are, even though they contain those nutrients, they're also highly processed. Obviously, because that's how you're going to fortify them. They're processed and then they add in the micronutrients. Unfortunately, many of them also contain other unhealthy food subgroups. So very high amounts of fat, salt, sugar, and so on. And so they're not as healthy as if you were eating your raw grains or your raw food or whole grains. Completely agree. But there are some instances where you need fortified foods, and to eat and eating them in moderation, being aware that they can cause problems if they're taken in excess, is the way that most people would consume their fortified foods. So saying that because I recommended, which again, I did not recommend fortified cereals and say, oh, go ahead and start taking fortified cereals, because I appreciate that fortified cereals contain a lot of sugar. So I wouldn't recommend that you go over and just start taking fortified cereals. If we were having a conversation around diet and the type of foods that one would use for fibroids, we will talk about avoiding foods with very high sugar, very high salt content that can contribute to inflammation. We're talking about fortified foods that contain minimal amounts but contain the essential micronutrients. For example, things like iron, because women who experience fibroids can go through very heavy bleeding. So foods that are fortified that contain iron could be of value to them if they're not able to access other sources, maybe natural sources like raw food or whole grains that contain those supplements. Okay, so fortified food may be a very good option for a woman who is not be able to access that. So I think it's wrong to make a blanket ban, and you did not even finish watching the video. And I think that's really very poor. And I'm going to say this to Wondering Inca, so that hopefully when you watch this, if you watch this segment of the video, you don't do that again. Sit down, be calm, and try and go through and get the point the person is trying to make. That said, I still appreciate the fact that you actually left a comment to say why you were not happy with this information, because I think there may be other people out there thinking, oh, fortified food is totally bad. And I would say that there's some, in fact, many fortified foods that contain a lot more of those pro-inflammatory elements than what we need, like salt and sugar and fats. The other type of micronutrient that will be useful in fortified foods is folate, vitamins like vitamin D, which you can find in dairy, you can find in milk. There are some people, depending on where they are located or depending on where they are, may not be able to source your natural or fresh sources of food. And I think that we should be considerate and allow that there are different options available. So I'm going to round this up by saying again, thank you for your comment and expressing the fact that it doesn't really make sense when you're having or perhaps that's not the right way to say it, but I don't particularly agree with giving a blanket ban on all fortified foods. But your comment acknowledges, I do acknowledge the fact that fortified foods can contain very highly processed components, things that are pro-inflammatory, and they are not safe or not good for us, especially when we're dealing with fibroids, where there is some association between high sugar intake, high inflammation, and the development of fibroids. So I think the key message there is not all cereals are equal. Whether it's fortified cereal, whether it's fortified dairy, fortified milk, some are minimally processed, and it's a good idea to look at the labeling. Okay, they're unsweetened options which contain reduced or less, or in fact no sugar added to it, but are still fortified with essential micronutrients. Is that wrong? What if that's all that somebody has access to? So really important, point that I wanted to get across. But again, I salute your leaving that comment. If the spirit it was left in was sort of being disgruntled or not happy, I hope this explanation helps. No fights at all at Wondering Inca, but I do appreciate that you took that time. And if you intend to ever come back to the channel, leave me a shout out. Tell me that it was you who left that comment. And perhaps there is a video on my channel that there won't be any quibbles about. So that was the first comment or question that I wanted to respond to. I wanted you to have a look, you viewers to have a look at it. I'd love to know what you guys think. What is your mindset around fortified foods? How much of what is your position when it comes to fortified foods? Do you share the same mindset as Wondering Inca? And once any person mentions anything to do with fortified cereals or milk by way of recommendation, that's it, you cancel them. Let me know your thoughts in the comment section. But while you're doing that, don't forget to give the video a like, of course, and please subscribe to the channel. I will take a quick break now, and when I come back, we're going to move on to the very next question to consider. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Feeling unwell? Thank you so much, guys, and welcome back. And again, my apologies for the glitches and tech issues in the first half or the first part of this this live stream. I really don't know what's happening, but we seem to be going steady now, and I will definitely sort of cut off those excess bits in the if you're watching the replay. So thank you so much for joining. I'm Dr. Sylvia. I'm a general practitioner. I'm based in Sheffield. I really appreciate you spending time with me today. We're talking about issues to do with fibroids, and we're talking about Bartholin's glands, cysts, and so on. A few questions that have come into the channel. My live streams these days are dedicated to questions or comments that I think would be of quite general interest, and they're real questions that people like you put into my comments section and ask, and I'm really happy to address them. Always remember, of course, that I'm not your medical doctor. I don't have a lot of your health information, so of course I can't provide you with direct advice. I would simply provide information that is evidence-based as much as possible and ask you to go and see your doctor, who then has all your information and can make the right information based on your symptoms. So we've tackled the first question for the day, and we're going to go on to the very next one. And of course, if you do have comments or questions around the topics that we're discussing today, please pop them in the chat. Always very much interested to hear from you. Or if you just want to say hi, if you just want to say, hello, Dr. Sylvia, nice to see you, and tell me where you're watching from, what you're up to today. Yeah, I would definitely love to hear from you. So let's look at the very next question. I'm just going to put it up on the screen. And so this is a Bartholin cyst question. Let me go through the question quickly, and then we can have a little conversation around it. So this is somebody who says they just had marsupialization the day before, and their doctor has asked them to come back. I think this is probably today. The doctor has asked them to come back for a dressing to change the gauze inside, and they're really worried about this. It's their second time to have this type of surgery. Before it was on the right side, and now it's on the left side. And the doctor said it's because they didn't follow what she said to do before the dressing because it was too painful. I'm a bit unsure about this bit, but this is the message as I received it. And then she says, the doctor says the doctor says, I can't use any medicine to lessen the pain, only take painkillers. But I saw some medicine that I can use. Is it okay to use this EMLA cream before the dressing to feel less pain? I hope you can suggest what to do. Thank you so much. Thank you for sending that question in. I think I'm back full screen. Thank you for sending that question in. Very interesting. So let's quickly sort of just break it down for people who may not be familiar. We're discussing Bartholin's cyst. And we're discussing Bartholin's glands. I wish I could show you pictures of this, but YouTube does not tolerate those kind of pictures of sensitive and intimate areas. So I'm not showing any pictures. Please, Google or search for an image, or I might actually put a link in this video description so that you can go to an image and you know what we're talking about. Now, the Bartholin's gland or Bartholin's glands, because there are two, are glands that are based or located in the vulva, specifically at the entrance of the vagina. So you can say that they're sort of vaginal glands. Now, the job of those two glands, they're on one side, right side, left side, is to produce the liquid that lubricates the vagina. That's their job. Sometimes, and for different reasons, it tends to happen more commonly if a woman is sexually active and within the childbearing age, sometimes after childbirth, if somebody has had an episiotomy or cut to the vulval area. Themes we don't know why, but sometimes a cyst, that is a sac, develops around the gland. It tends to be because there's a blockage between the gland to where it opens up into the vagina to release the fluid. A blockage happens, and that makes a part of the gland swell, and that's what we call a cyst. Many times it happens is a very small thing. You may not even know that you have a Bartholin cyst, and then it disappears by itself. That's the experience for many women. But sometimes it can happen over and over and over again. Sometimes it can get quite big. Sometimes it can get infected and cause extreme pain. So to different degrees, even though it's not a life-threatening problem, it can cause quite a lot of distress. Now, I have a few videos on Bartholin's cyst and Bartholin's gland and so on, Bartholin's abscess on the channel already, short standalone videos. I don't really want to go into too much detail about it, but this is just an overview of what we're talking about. So let's get to where this viewer is coming from. Now, I think she's told us actually in this question that she's had this problem before, so it's not new. She's had something called a marsupialization, which is a type of surgery that your gynecologist will perform when you've had Bartholin cyst and perhaps it's become infected and it's happened more than once, so it's becoming troublesome. And so what they will do is they will pop or burst the cyst, they will drain it of any fluid or liquid it contains, and then they will stitch the edges of the cyst to make a kind of a pouch, an open pouch. So if you think of a kangaroo and you know where the kangaroo's baby stays, that's a pouch. It creates that kind of opening, and that's where the name comes from, marsupialization. Somebody's leaving a comment. Let me just quickly check because, hi. I've just interrupted my spiel just to check because I remember the last time I was just going on and on and on. Somebody sent a comment and said, we can't hear what you're saying. So hi, Amy. Thank you so much. I appreciate your joining. You're watching from Stoke-on-Trent. I'm so sorry. Suffering from fibroid pain and bleeding. Oh, wow, for 6 months. Oh, wow. Finding your videos very helpful. I appreciate that. I'm so glad. And I hope this episode also provides some clarity. I'm tackling specific questions, but thank you so much for shouting out. It's good to know who's watching and hear where you're watching from. So thank you so much, Amy. Good to have you on this stream. So we're talking about the Bartholin's cyst and gland, and I'm trying to explain what marsupialization is, which is that procedure where eventually that's that cyst that was swollen, the doctor has popped it and they've created a pouch. Basically, they just kept the cyst open. Okay, it's a tiny opening, and the reason that's done is so that it does not collect and swell again. So it's just left open permanently, and so the risk of it forming again as a cyst and causing all the problem doesn't happen again. That's the procedure. So let us bring up the question again, now that I think I've explained it a little bit, so hopefully you understand what it is that she's referring to. So she had this marsupialization thing done, and the doctor asked her to come back, as they do, because they want to check the dressing, they want to change it, and they're really worried about this. And it looks like when it first happened, there was a problem. I think she said it was very painful. And, you know, I appreciate this question because it's very real, and it's good that we, as doctors, tell you what to expect. It's uncomfortable, the procedure. Now, ideally, she should be on some regular pain medication. That can be ibuprofen or naproxen or paracetamol or codeine or whichever, depending on your medical history. Again, I can't give you any specific tablet or drug to use to manage the pain. This is your doctor should do that. They know your medical background. They know what you can tolerate, what you're allergic to, and so on. But this viewer has specifically asked us about using EMLA cream, and I want to discuss that. First of all, my answer to you would be to say, I can't recommend that you use any specific medicine. Again, the reason is because I'm not your registered medical provider. I don't know your medical background. But I want to go into a bit more detail why I don't think EMLA particularly is a good idea unless your doctor has okayed it with you and there's a plan for how to manage it. So let me share my screen again and just show you what EMLA is for those of you that may not be familiar with EMLA cream. And it's something that usually will be prescribed by your doctor, but I noticed that you can get it off some online pharmacies. Although when I checked Boots does want you to have a review with the pharmacist first before they will sell it to you, because it's quite specific in the way that it's used. Your doctor could, with their own discretion, could decide to use it in a different manner, but at least they've taken into context whether or not it's safe for them to use it in that manner. So the EMLA cream is an anesthetic cream. So it's a numbing cream, a pain numbing cream that's applied to areas of the skin, usually before an injection or a minor procedure. It's a skin cream. It's a skin cream. It's not a cream that's meant for inside or underneath the skin. So to whoever's watching or whoever sent in this question, and I will share the link to the video, I promise I will, so that you can watch it and then, you know, have the information. This cream is meant for the skin only, and is usually used for reducing the pain before the needle of the injection, and it's particularly for little children who you want to give an injection or you want to take blood off them. I remember them using it for my daughter a few years ago, and of course we used it for kids in treatment, and it does the trick. You know, it takes the sting, it takes the pain away, it does the trick, but it's quite specific. I would certainly not recommend using this by yourself at home without the supervision of a medical provider. And it also goes on to say in the medication leaflet, in the patient leaflet for this drug, do not use it on broken skin. You already have broken skin. You have a cut on your skin, because remember, this marsupialization process that you've had, they've popped your cyst, they've cut into the cyst, and they've stitched the edges together, so you have broken skin. Or where there's skin rash or eczema, you also should not use it near the eyes or the nose or the mouth. And it says don't apply it near the anus or the genitals. And there's some people who should not use it or should be careful about using it, who have conditions like methemoglobinemia, where the body blood doesn't carry oxygen as effectively as it should. G6PD deficiency, if you have that, you know what it is a condition that affects the blood cells and can lead to destruction of the blood cells prematurely and cause something called hemolytic anemia, or if you have something called atopic dermatitis. So the other thing I wanted to mention is, if you look in the top right hand or left hand of this image, you can see the disclaimer. This is from Boots, and I just put it up there because I thought it was important. They say that you should have a conversation with the pharmacist, so you just can't buy this medicine. So I would strongly advise against using this except under medical supervision. I know it sounds tempting, and I appreciate that it's a very uncomfortable time that you're having. And I think that the best thing to do in this situation, let me just pull up the question again. The very best thing to do in this situation is to go back and have that conversation with your doctor, give them a ring, or depending on where you're located, if, for example, you're in the UK, where we have, the out of hours service, and it was not, your doctor was not on duty, and you contacted us, and then we would look at what other kind of pain medicine options that we could provide that would be safe for you. But specifically with regards to EMLA, which is what you asked about, I would recommend that you speak to your doctor about using this. Hopefully you've had your procedure. I think it's also important to say about being scared of procedures, and I'm saying this here because there's another question coming up in a few moments where we're also talking about worry or fear about certain procedures and being anxious about pain. And it's a bit worrying because there are painkillers that we should explore for our patients when it comes to either before procedures or after procedures, to help to manage the pain as the body recovers. And it may be that you need to have this dressing for some time before the wound completely heals, and you have regular dressing change. So please have a conversation with your doctor. Please don't feel that your doctor is blaming you because of what happened the last time. No, I think most doctors will be quite sympathetic. And if you say that you're experiencing pain, what can you use? Ask your doctor about options, what you can rub on the skin. They're the ones who performed the procedure. Ask them, what can you put on, what can't you put on? Ask them how soon, what you can do, because they will know that it's very uncomfortable in this area. You want to pass urine, for example. Urine is acidic and can sting, wounds when you're passing urine. So you're free to ask those kind of questions of your doctor, how to clean the area, how to be careful so you're not damaging your stitches, you're not damaging the wound itself while it's trying to heal. And I think if it isn't, I was just thinking that I probably have one of those videos where I talk about aftercare when you've had these surgical procedures and looked at different ways, not just medicine, look at different ways where you can manage the pain. So I think these are conversations that you can have with your doctor. Some people find employing breathing techniques in addition to regular painkillers, they might find it useful. Having regular changes of the dressing, okay, so that the dressing doesn't contribute to an infection coming back, especially if it's not being looked after properly, or if it's not being looked after hygienically. The type of clothing, underwear and clothing to wear at this time, so that it reduces sweat in the area that can further contribute to infection. So, and then of course, having a communication with your doctor. Please don't be frightened to do so. So we've talked about the answer to that question. I'll just put it up on the screen one more time, that this is what we're talking about. Let me know what you guys think. Let me know if you've had this kind of similar scenario to deal with, and how you handled it, how your doctor handled it as well. That would be quite interesting to know, to make sure that people are getting the support that they need. So that's question 2, that's done and dusted. I hope you found that useful, guys. Let's take another quick break. And when we come back, we're going to be looking at the next couple of questions. And we're back. Welcome back. Thank you so much for joining. Thank you for watching. Let me know what if you're getting some value out of this question. The first thing we talked about was fibroids and fortified foods, or really about fortified foods, and how one of my viewers felt very strongly about it, and we've tackled that, I think, quite well. But let me know your thoughts. The second one was around, we've just finished that conversation around using numbing cream where you've just had a vulval cut, a cut to the vulva, or an operation to the vulva. And my advice to that was to speak to your medical provider about it, because that cream is usually recommended to use under supervision. There are specific instances when it's supposed to be used, although when your doctor is familiar with your medical background, they might consider uses that are not mentioned on the leaflet, but it has to be under supervision, and it's not supposed to be applied to skin that is broken. So, it's something that I think is really important to consider. If you're just joining, thank you so much. Please give this video a like. I really appreciate your popping in and just having time to look into things with us. We're going to go on to the very next question that I have. Remember that today's topic is all about fibroids and about Bartholin cyst. So the very next question is related to what we've just been talking about, which is good, because then I don't have to explain all over again what a Bartholin cyst is. So let me put it up on the screen. And if you have a question around fibroids, around Bartholin cysts, then I'm happy to take it. If it's related to something else, I might not be able to cover it unless we have time. This live stream is slated for about an hour, so unless we have time at the end. But let me just go straight to the very next question that we have primed for today's session. Okay, so this is a very interesting question. It's it's a very interesting question. I actually debated doing a separate video on this, not part of the live stream, but I'd left it for quite a few days. So I thought, let me just address it and then share it with the person who sent it in. So they said, thank you so much for this informative video. You're welcome. It's referring to one of the videos I did on Bartholin's cysts or abscesses. So I have a few questions. There are quite a few questions on this. She got in quite a few questions. What are your thoughts on fractionalized CO2, carbon dioxide, laser treatment, alcohol, sclerotherapy, and silver nitrate treatment? They all destroy or damage the cyst sac so that it doesn't recur. I'm wondering why these fairly easy procedures are not the standard of care for Bartholin cysts, or is there something I'm missing? My last question is related to the first. If you destroy the cyst sac, are you also destroying your Bartholin's gland? Or can the cyst sac be destroyed without damaging the actual gland? If the gland is destroyed with the cyst, does your body stop creating any lubrication for sex on that site anymore? Like I said, I really love this question. I know it sounds a little bit technical, but really, if you've had a Bartholin cyst or abscess and it's come back and come back and come back, because perhaps the treatments you've had haven't worked, or you're exploring the least invasive options for treatment, then this question would make a lot of sense. So the first one was about my thoughts regarding these methods, and it described a couple of different methods that we don't commonly mention or suggest when it comes to treating Bartholin cyst. And as they said, these are effective methods. Okay, these are effective methods for treating Bartholin cysts. Using carbon dioxide laser is a process where the wall of the cyst, I beg your pardon, I think I should get a drink. Guys, give me a second. Sorry about that. So using the carbon dioxide laser uses the vapor, the air, the carbon dioxide gas to destroy the cyst wall, but the gland itself is kept intact. Alcohol sclerotherapy is when high strength or high concentration of alcohol, small amounts, is injected into the cyst for a short period of time and removed, so that it dries up and closes up the cyst and keeps it closed. And the other one is silver nitrate. Silver nitrate sticks or silver nitrate treatment is when they put a piece of silver nitrate, which again does the same, something similar. It really burns out and closes the cyst. So all of these treatments are if you like, alternatives to having something like the marsupialization that we're just talking about in the last segment, because I explained that marsupialization is when the doctor opens up the pops open the cyst, drains it out, and then they stitch the edges of the cyst so that you have a pouch forming, an opening forming, whereby the cyst cannot close up again and then fluid collect inside it. So that's one option. These other three, the carbon dioxide, the alcohol, and the silver nitrate, are also options. What are my thoughts? They're valid options. They're valid options. The research suggests that they have similar results in terms of how effective they are in treating the condition, that is removing the cyst. And some of them even have may even have less side effects. Some may have less side effects and less time to recovery. Some. You may have side effects from things like the silver nitrate stick. It might cause burning, because the way that works is by burning the space or the cyst so that it doesn't, it closes up as the tissues heal, and so the cyst can't form again. So there may be some side effects associated with that. It might also lead to scarring. So it's important to make a note of that. Now, so my thoughts with regards to that are they are valid options. And when it comes to options, there are several considerations. It's not just that it's available. And one of them is the expertise to actually conduct the method. So if you're thinking about any one of these methods, you should be asking whether your specialist has performed them. It seems that we don't have as many studies on those particular methods as with marsupialization. I don't know why that is. And it's something I'm interested in, actually, I'm looking into. But where I'm based, women do tend to have marsupialization. It tends to be offered more. But I think it's a reasonable conversation to have with your gynecologist about alcohol therapy, for example, or carbon dioxide therapy or silver nitrate. But just bear in mind that they do carry side effects. So for the carbon dioxide laser treatment, it may be that the equipment might be expensive. I'm not saying specifically for any service, because it may differ from one location to another. It may be that the individuals to apply it or to use it who have enough expertise to do it without causing any complications are not very many. But it's a good method in the small studies that we've seen, where they say that there is up to over 90% success rate with just one application of the carbon dioxide laser. It can be done under local anesthesia, and women can recover very quickly. So it may be that we don't have enough specialists trained in deploying this method, or the equipment to put it together for a particular clinic or facility may be too expensive. I'm just sort of thinking why it may not be as popular as marsupialization. With regards to the alcohol method, I'll sort of say it may be something to do with, again, having a trained or qualified specialist to use that method properly to minimize the risk of damage, because we're discussing applying treatment in a very small area, the vulva. And you want to make sure that you're using the alcohol for just the precise amount of time, a small amount of time, and a small quantity, so that you don't go on to cause damage to the surrounding skin. So this is a very specialist area, and that might be why it's not something that is popularly offered. Again, something to have a conversation with your clinician. If you who posted this question to me or anyone else are considering this option for yourself. And I've mentioned already about the silver nitrate stick, which is like a chemical burning, if you like, to close up the cyst. It can also cause similar symptoms. If one is not very careful when handling it, it might cause scarring, burning to the vulval area. You want to be very, very careful to avoid it. Avoid such developments. So that was the first part of the question. Let me just go back and see my thoughts about this. I agree, they all destroy or damage the cyst sac so it doesn't recur, and they do that quite effectively. And I think I've answered the second one, why these fairly easy procedures are not the standard. And I've explained a few reasons. And I think speaking with your specialist may also divulge other reasons why it's not something that's practiced commonly. And so the last question if you destroy the cyst sac, are you destroying your Bartholin's gland, or can the cyst sac be destroyed without damaging the gland? So the answer to that is, if you destroy the cyst sac, you are not damaging the Bartholin's gland. So if you imagine if I had a cyst on my nose is still going to be there, but the cyst is an additional tissue, a swelling of part of part of the section of the nose where the cyst is. My nose is still going to be there. So if we're going to get rid of the cyst by either popping the cyst open and stitching it out or something, you're not damaging my nose, it still remains. So destroying the cyst sac does not lead to destroying the gland. You can destroy the cyst sac and have the gland remain and function as it should. And I think you said, if the gland is destroyed with the cyst, does your body stop creating any lubrication for the side, for sex on that side anymore? Yes, it does. And there are some instances where the gland itself is destroyed. Of course, this is a very, very worst case scenario where different measures have been tried and they've not worked, and somebody keeps having this problem recurrently and it's causing problems. Then yes, the gland will be destroyed. And if the gland is destroyed, then it can no longer produce the fluid that lubricates the vagina on that side. So I think these are really interesting questions. They were a bit of, theoretical, but again, I said this might really appeal to somebody who's particularly interested in exploring alternative options. But thank you so much for sending this question in. First of all, I appreciate the fact that you took your time to watch the video, you found the video helpful, and then you went away and sort of thought of things that were relevant. I really appreciate that. So thank you so much. I will put the link to this video, to this segment, so that you can see my responses when you're watching the replay. So guys, we're coming close to the final question. I've intentionally kept it for the last. I hope you're getting some value from this. Please let me know. It's good to hear back from you. It's good to get your likes to the video to show that you're finding them useful. And of course, consider subscribing to the channel. So we've handled 3 questions and comments, I think, that were quite interesting. We're going to look at the 4th one now, which involves fibroids. Let me just take a quick break and have a look at questions coming in. Like I said, I'm happy to comment on or respond to questions related to the subjects that we're discussing, because I don't want us to go too far. And again, so I'm just going to pull up a couple of questions where I really don't think I'm going to be able to answer them. And I apologize. But again, I said I do not give specific advice. So somebody, Bumblebee, says, I've been in severe pain, bleeding severely all weekend. I was told that I have fibroids and an ovarian cyst, and you're perimenopausal. Okay. And have a saline sonogram and endometrial biopsy coming up. Should I get endometrial ablation? Also, is a natural way to handle the pain when my menstrual cycles finally come. It can be debilitating. I'm so sorry, because obviously you're going through quite a lot. And I really think these are good questions to sort of sit down and speak to your doctor around. It seems to me that the bleeding is most likely coming from the fibroids. The sonogram and the biopsy are likely to get more information about your system. So to understand what the lining of your womb looks like, and the ultrasound, that's the sonogram, to understand the type or nature of fibroids that you have, because of course there are different types of fibroids, to be able to understand their location. And I think at that point, it makes sense to have a conversation with your doctor about the different treatment options, and endometrial ablation, which is burning away the lining of the womb. That is one of the options. So Bumblebee, I can't say to you yes or no whether you should go for endometrial ablation. I do think it's one of the options to consider, to discuss with your doctor. And depending on the size and location of the fibroids, they might also be looking at removing the fibroids. Now, that can be done either via a myomectomy or uterine artery embolization or uterine fibroid embolization, which is a minimally invasive procedure where the blood supply to the fibroid is blocked off, and so the fibroid shrinks away. And of course, there are medications, so there are different options. And then you added a question. You said, is there a natural way to handle the pain when my menstrual cycles finally come? It can be debilitating. Yeah. So what fibroids do, And I'll refer you to my channel, and I can't remember the title of the video, but there's a video dedicated to how fibroids behave after menopause. But you can't predict. For some women, fibroids shrink after menopause. And in fact, for a long time, we thought that was it. When people get to menopause, fibroid issues stop. And we find that that's not the case for every woman. I don't know what the situation will be in your case. And it does depend on the treatment that you decide to go ahead to have now, whether you will experience any pain during your as you enter into menopause from the fibroids. Again, there are different options, and you're talking about natural options. We have looked at supplements, for example, that could help to contribute towards managing fibroid symptoms. Some people find relief from things like a combination of vitamin D and green tea. The EGCG extract of green tea combined with vitamin D. There's a study, it's a small study. We don't have any big studies on these things, so that's why it's not mainstream advocated. But a small study suggested that some women found that it helped to reduce the amount of blood loss and in some shrink the fibroid. It also depended on the type of fibroid that they have or they had in that study, as I can recall. I think I also have a video on the channel where I discuss that more. So there are, as you say, natural options. I think the important thing is, having these conversations with your doctor, because I think they're very good questions that you've posed. Managing severe pain with fibroids. I don't know what painkiller or pain medicines that you're taking, apart from painkillers, whether things like a TENS machine, which can help with pain, warm heat from a water bottle. I know that sounds very local and very, common, but for some, it might also make a difference in addition. Sometimes some people find yoga and certain positions can help in terms of, providing increased blood flow to the womb and helping to deal with pain. And these are some natural ways that don't depend on just medication. But the tests that you're having, I think these are important tests to help to guide your doctors. What type of fibroids are they dealing with? Where are they located? And what does your womb, the lining of your womb look like? And that will guide as to whether endometrial ablation is the preferred option for you. I can't answer that, but it's certainly one of the options that may be of value. And there are other, if that isn't, then there are other options that you should have a conversation with your doctor about. So Bumblebee, I hope that's been helpful, but thank you for popping in. I don't know if you're still here. Thank you for popping in and sending in your questions. I hope that things ease a little bit for you, or even a lot for you. And I hope that you can have more discussion with your doctor to help to get on top of this. Right, let's move on to the very next question. I won't take a break. Let's just go on to the very next question. And this might take us a little while to go through. Yeah. So let's read this together. What does one do when mine is blocking? I know that sounds strange, but this question is in relation to in relation to fibroids. So this person says she's had a CT scan. They've tried to use the drug Provera to manage her bleeding, to stop her cycles. And then she's now been referred to her gynecologist because despite these measures, it didn't stop the bleeding, it didn't stop the problem with the fibroids. The primary issue is that the fibroids appear to be causing blockage to the kidneys or the bladder, or both actually. And the fibroids, she says, are messing with her kidneys and abdomen area. And this is where the blockage she's talking about. And, I mentioned earlier about somebody being frightened about having a procedure. This is somebody else who says that they are very afraid to be put under. Under means put under anesthesia. They're meeting with their gynecologist soon. It looks like it's tomorrow. They're meeting with their gynecologist, she's told us. And they need to have a conversation about what their treatment options are. And of course, she's worried about hysterectomy. They're very scared. I think there's something else. Oh, yes, she mentioned that she's been constantly catheterized. So let's unpack this. So thank you for sending in this question. I'm so sorry that you're having this very distressing experience with the fibroids. And I just want to acknowledge the fact that this is a very difficult time that you're going through and having to make decisions while you must be feeling so unwell. But there are really important issues to address here. And for me, the first one is obviously the fact that the fibroid is apparently the fibroid, because you didn't tell us anything else. So we have to assume that it is the fibroid. You said they've done CT scans and they told you that it's likely the fibroid that's causing this problem. So it's grown to the extent that it's blocking your bladder, at the very least, blocking your bladder, because the catheterization she talked about is when the doctors or the nurses pass a tube through your urethral opening in the vulva into your bladder, and they're trying to relieve a blockage because urine is not able to come out of the bladder naturally. And that can happen because the womb is sitting behind the bladder. Okay, the womb is sitting in between the bladder and the anus and the rectum. If a fibroid in the womb or from the womb has grown so large that it's pushing forward, it can block the entrance to the bladder, and so cause a problem that women with fibroids, large fibroids, can experience, whereby they are struggling to pass urine, or they go into something called urinary retention, which is a medical emergency. And what it means is that you're not able to pass urine. Urine cannot flow out of your bladder. So urine is now collecting, staying within your bladder. Now, don't forget that at the top of your bladder, you have two tubes that are coming from the kidneys. So urine now begins to flood backwards into the kidneys. That is not a good thing. That is a problem. It can cause damage to the kidneys. Over time, it will cause swelling to the kidneys. It can cause damage to the kidneys. So all this from the fibroid. So this is a really serious situation that we're worried about. And of course, if the fibroid is causing that kind of problem, I can only imagine the kind of pain that you may, or discomfort you may experience from the pressure that you're getting thanks to the size of the fibroid or wherever it's located. Maybe it's pressing on your bowels, or pressing on the ovaries, or pressing on everything else, causing so much discomfort. Clearly, the attempt to use Provera, that is progesterone, to control the bleeding, that clearly didn't work. So now we're looking at what options are there. So I think the most urgent things are to rescue the kidneys. I presume this visit to your OB/GYN shortly is to establish exactly what are causing this problem, what type of fibroids they are. Perhaps they want to do more scans or other tests, maybe an MRI, to identify the exact location of this, because I think you said from the CT scan they couldn't tell you, or they couldn't determine. So they may need to do further tests to examine that. Please be open. I know this is really worrying. I appreciate that it's very fearful, very anxiety-inducing, very scary, basically. Please be open with your doctor. You've never had surgery before. For everyone, it's the first time. And even if it's so-called simple surgery, even if it's a dental procedure, for example, extraction of a tooth, people are apprehensive about that. We talk less of either being put to sleep under general anesthesia, or even if it's not general, if it's like a spinal anesthesia where there's loss of sensation to just a part of the body, even if it's that, it's enough to cause alarm. Please be open with your doctor. Perhaps ask to speak to whoever is going to be in charge of putting you under, and let them explain the process to you. Because I find that when we talk to people about what's going to happen, tell them this is going to give you this medicine, is going to make you go to sleep, and this is what's going to happen, this is what you feel. I think that kind of pre-information does help. So I think a good thing to do is to express your worries to your gynecologist about this procedure. It could be helpful to go along with a friend whenever you're having the procedure. If you can put that at the back of your mind, or whenever you're seeing your gynecologist, go along with someone that you trust, who knows your concerns. Because while you might be trying to take everything in, being the person that it affects, it might be a lot to take in at once. But your friend or relative or whoever comes with you may have more presence of mind to ask the questions that need asking, make the points that need making on your behalf. So that's something to think about. But before I get too distracted, I think my concern is really about your kidneys. Your OB/GYN, I beg your pardon, may want to get a kidney specialist involved. depending on any blood test that you're having, any appearance of the kidneys that they're seeing on your scans and so on, or you may already have them involved because they really need to make sure that your kidneys are safe, your bladder is safe. That's a really important thing to do. That the degree to which any complications have set in may also determine what kind of treatments that you have. I know you've talked about hysterectomy. I am not your medical provider. I don't know your medical background, even though you've provided a bit of information to us here. I'm not saying hysterectomy is the best or the worst option. The best person that can help you make that determination and who you should work with are the specialists looking after you. Of course, there are other options for managing fibroids, but maybe they want to get things sorted out ASAP. Maybe they're able to remove the fibroids without removing the womb. So maybe that's something. And I think I think you should ask. I don't think you should be scared of asking, are there any other options? Because you've mentioned hysterectomy. Why? Who said that? Was it a specialist that said that to you? So before the final decision is taken, what other options are there? Would myomectomy address this problem? Would it be easier for them to do a surgery to remove just the fibroid? Because it may be that's all that's needed. Again, I don't know. I haven't seen the scans. I don't know. Or are there any other options? Is there enough time that you can have procedures like a uterine fibroid embolization? Could that be an option? Again, I'm not saying for definite. I'm just saying ask, okay? Because if you don't ask, you don't know. So don't just assume or say, oh, somebody has mentioned hysterectomy somewhere, therefore it must be hysterectomy. No, please. And of course, are there any medical options that they're considering? There's some hormone agents that they give before surgery to help to shrink the fibroid a little bit so that it's easier for surgery to happen, where you can just remove the fibroid and you don't cause any injury to the womb. In terms of controlling pain, again, I don't know if these measures have been used for you already, whereby it's not hormone. So for example, tranexamic acid is something I talked about. I have a video dedicated to that drug that's used for managing heavy menstrual bleeding for different reasons. But of course, it needs to be under medical supervision to be sure that it's appropriate for you and that it will help in your situation. So I think what I would insist is to have a conversation with your specialist about options. So you want to address your anxiety in the first instance, talk to your specialist. They can make sure that you have a conversation with the anesthesiologist, whoever is going to provide your anesthesia if you're going to go under. Speak to your obstetrician, your gynecologist about different options for treating your fibroids. Bear in mind, it will depend on how it is related to the issue with your blood, your bladder and your kidneys, because your kidneys are, precious organs that we want to make sure do not suffer permanent damage or damage that cannot be reversed. So, and it's important that they address that very, very quickly. What I would really encourage you to open up about your concerns. They are valid concerns. You don't have anything to be ashamed of. Anybody who is your clinician should acknowledge and empathize with you over those concerns, recognizing that we're all human, and help you to meet and deal with those fears. And I think you can deal with them by having open conversation with them, coming along with somebody to have that conversation, whoever specialist you're meeting, and perhaps seeking a second opinion about these things. So, I felt there are a few good questions that you can ask your specialist when you see them soon. Ask about confirming the size of the fibroids and where they are located, so that possibly options that are not hysterectomy can be explored. You can ask and hear what they say. You can ask about, look, what's my kidney function? I've had catheterization. You've had it at least once, if not twice, from your message you sent to me. So how much risk is your kidney function, or how much risk are your kidneys under? How worried are they about your kidneys? Ask about preserving your womb. Ask them whether having a myomectomy or uterine artery embolization or using medication, are there options for managing this fibroid so that your womb is preserved? And giving your anxiety about being put under, what are the options for anesthesia that you could have? Those are the kind of conversations that you can have. You can write them down. Don't feel rushed. Go along with somebody, you know, and, you know, have these conversations. I want to end by saying that I think that there is a lot of potential for a very good recovery for you. These conditions are treatable. Even the condition where, you know, I was describing earlier about urine flowing back into the kidneys and causing the kidneys to swell because of the blockage occurring lower down in the bladder. It's something that's treatable. And the important thing is recognizing it and treating it quickly. So please don't panic, but it's important that it's addressed quickly. I think you said you're 42, hysterectomy is not the only option. Given the limited information I have here, again, it's important to have a conversation with those who know you quite well, and so they can provide all the options that are available given your medical profile. And of course, that anesthesia is, you know, is safe. We've gone such a long, many years in terms of medical knowledge, in terms of research. There are different tools that our anesthesia colleagues have to manage anxiety, because it is a common problem. So there are different ways they have of managing anxiety, different anesthesia options they will consider that's appropriate for your age, for your medical background. They carry out pre-surgery assessments just for that purpose, so that they can provide the best care for you. So please don't panic. I think that a lot is possible to help you get back into very good health. And I wish that happens for you. I hope that happens for you very, very soon. Okay, I think that's the last I'll say on that subject. Friends, thank you so much for joining me today. It's a long one. I've spent longer than what I'd planned. Of course, there was that glitch at the beginning, which I cannot explain, but everything has been smooth since then. I think another comment came. Thank you so much, guys, for posting these comments. Have they been all from YouTube? They've all been from YouTube. Thank you so much, guys, on YouTube. Guys on Facebook and LinkedIn. Perhaps I didn't say specifically hello to you, although I think I said hello to everybody generally. So this Brian says 3 days after synchronic hematoma bleeding, but with good ultrasound results. She got one sharp abdominal pain and sudden stop nausea, but she's still having her pregnancy signs. Should she worry? She shouldn't worry, but she should speak to her doctor. She shouldn't worry. She should speak to the doctor so the doctor can take a full assessment, because I can't answer this question. I can't say, oh, it's all fine. No, that's not fair. I don't do that, because there isn't enough information to be able to do that. So she's had the ultrasound following some bleeding, and the ultrasound showed that the baby is fine. And then it looks like she developed pain afterwards. Where was the pain? How long did the pain last for? You said she's not having nausea, but still having pregnancy signs. Nobody can answer this question to you online. She should speak to her doctor so they can assess her, decide if they want to do check the baby's heart with Doppler, depending on how many weeks she is, or if they need to do a scan again, is what I'd recommend. And that should be done as soon as possible. But I don't want her to worry, because, you know, worrying just makes her anxious. You know, there's no need for that. Just quickly speak to the doctor. Everything's probably going to be fine. Unfortunately, I can't tell you that, because I don't have the information to be able to do so. You need to have some tests to be able to confirm that. Whew, well, goodness me, you guys, you have kept me going with questions. But I love it. Thank you so much. What I love is being able to share experience with you. This is what we do on this channel. Try and provide clarity, try and provide guidance, try and provide information that would hopefully set you on the right path, take you back to your own practitioners to say, you know, please clarify this, or can I get more information, or how about this? And so that you have a whole hearty, healthy, excellent quality health experience. That is our goal. So guys, if you've not liked the video, please give it a like, and of course consider subscribing to the channel. Don't forget, we have so many other ways that we can provide you health support. There's askawayhealth.org, our website. There's our email health information service, also from askawayhealth.org. There are digital guides and ebooks that we have on our seller shop. All of these things I'll link in the description box below so that you can check them at your leisure. Don't forget to check out our community posts from time to time, where I put a poll or a quiz just to keep you on your toes. And I know you guys enjoy watching, responding to them. Thank you so much for spending a little bit of your Monday with me. I hope the rest of your week goes well. Please keep a lookout or an eye out on the channel for a video coming up again later on in the week. On, I don't even know what the topic is on, but I'm sure it will be something. It will be something that's of interest. Please engage with our videos. You know, comment the way you comment on the stream. Comment on the videos. Give the videos like. Put questions there. I'd really appreciate them. And yeah, thank you so much, guys. I'll see you again real soon. Bye bye. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Feeling unwell?